Welcome to the Egg Whisperer Show. I'm Dr. Amy, and in each episode, we explore ways to support your fertility and reproductive health so you can stay inspired on your journey to parenthood. I'm so excited about today's episode. Today's episode is titled Red Light Therapy for Female Pelvic Health and Fertility. And you're probably like, what is that? We're talking with Liz Frey, Pelvic Health Medical Director at Fringe, about how red light can support your reproductive system and overall pelvic health. Fringe is a company bridging traditional healing practices with modern science. She focuses on red light therapy designed to help women optimize their health. Liz, welcome.
Thanks so much for having me, Dr. Amy.
Oh, I'm so glad that you're here because what you're doing is teaching us something that a lot of patients just don't know about. And what I'd love to hear from you first is how you became interested in red light therapy and female pelvic health. And I think you have something special to show us that's pretty new out there for people to learn about.
I'm a pelvic health physio, and I became a pelvic health physiotherapist a little over a decade ago when, after having my first and becoming pregnant with my second child, I realized I had pelvic health issues myself. So after seeking help and recovering from a pelvic health physiotherapist, that's where I thought, okay, I need to dive into this field. I need to help other women. And I've practiced pelvic health for over a decade. And only in the last couple of years have I integrated light therapy with my practice. And that is because Alison Evans, the co-founder of Fringe, approached me, and we were previously friends and had worked together, but she approached me and was like, Liz, I've got this awesome idea and we need to bring it to market. And it is the Fringe Pelvic Wand. So what it is offering red light and near infrared light therapy. I've just turned it on for the people that are watching, for intravaginal tissue healing. And so for the last year and a half, almost 2 years now, Alison and I and the team at Fringe have worked together to bring light therapy healing for women for their pelvises.
Yeah. And so I want you to tell me how it works. And,
Mm-hmm.
a lot of doctors who might hear their patients start using this in the near future. I actually have a patient that just bought one, and they'll question the science and they'll be like, how do you know this works? Like, what is the evidence? What papers have you published?
For sure. So first I'll chat about how it works, right? So the light therapy wand has red light and near infrared light in it. Most products that you would see on the market when they talk about light therapy, they will have those two wavelengths of light in them. I'll turn it on for you. And then it also has a blue light function. So I'll just chat about blue light for 1 sec. And that is really to help with the vaginal microbiome. It's antifungal, antibacterial. So if women suffer from bacterial vaginosis, ongoing yeast infections, that kind of a thing, then the blue light can be very helpful. The red and near infrared light therapy is used for tissue healing, tissue regeneration, helping build elastin and collagen production, reducing inflammation in the tissues. I mean, my list can go on. The science behind it is really quite clear in that we have worked with lasers for years. Like, laser therapy for pelvic health is not new by any stretch. So around 2018, there was a number of published research articles that showed that what we have previously been doing with laser therapy can be reproduced with LED light. And that's why we're seeing a lot of different products, face masks, wraps, panels, etc., on the market, because they can use LED light therapy, which is, I'll say, safer for the consumer and at a price point that is actually digestible for the consumer. So that's why we're seeing it now in the marketplace, whereas we hadn't before, but the actual science behind it isn't new. So just a little bit of the science is when our cells absorb light from the sunlight, from laser light, from LED light, it doesn't matter what the source is as long as the wavelength of light is, say, correct or optimal. So our cells will absorb light, and the mitochondria, which are the little energy houses in our cells, for those that like to kind of nerd out at a cellular level with me here, a whole cascade of reactions will occur. And two of the byproducts of these reactions are nitric oxide. And as we know, nitric oxide is a huge vasodilator. So what will happen is in the tissues that are receiving the light, we'll have vasodilation, increased blood flow, increased circulation. And that brings oxygen and nutrients to our tissues for healing and for general tissue health and so on. And the second byproduct is ATP, which is energy. So our cells that are receiving and absorbing this light will have an increase in energy production. And again, that could be for tissue healing, tissue health, muscle building, strength, etc. So those are two byproducts. Other things that are happening at a cellular level are an increase in elastin and collagen production, which helps with the integrity and the elasticity of our tissues. So for women that have maybe some atrophy, some prolapse, different conditions where they'd really like to strengthen their muscles, then that can be very helpful. And then also a reduction of inflammation. So women that suffer from endometriosis, PCOS, any inflammatory condition, then the light therapy can be really helpful for that.
Yeah. And then what I'm wondering is, have you had patients use it and then
Yes.
feel much better? So tell me some of those stories. So someone who is suffering from BV and recurrent vaginitis,
Yeah.
did they experience relief after using the blue light? And then women who, let's say, have endometriosis, used it, like, did they experience less pain with their periods?
For sure. So, as far as the blue light therapy, I'll say testimonials and feedback that we've got from the wand, it has been, honestly, it's been shocking. It's been so much greater than what I even anticipated. Where actually, just recently, a woman wrote in and said something along the lines of, you may laugh at the idea of a pelvic wand, right? Because it does look like a lightsaber, right? We've got
Right.
lots of, I'll call them fun and funny comments about it. So she said, you may laugh about it. However, I've had chronic yeast infections. Nothing seems to touch it. Like, she's resistant to a lot of the antibiotics. And she said that the light therapy wand, after a week of using it, has done more benefit to her than any of the sort of treatments that she had in the past. So
Yeah.
something like that, I mean, that's awesome. That's really, it's a feel good, obviously. That's why we have the wand, and that's why we are wanting to help women with it.
Yeah.
As far as postpartum, we've had a number of testimonials as well that have come in for like wound healing, women that have had either an episiotomy or tearing, like trauma with their birth. And when they have used it externally, right, initially, so I'll just hold it up, you could use it externally along the vulvar area prior to being able to use it internally. They've reported like that their wounds have really healed quickly, and that's been like a main part of their healing process postpartum. And then menopausal women, we've had so many menopausal women with tissue dryness, tissue fragility, painful intercourse associated with that. And because of the increase in blood flow associated with the red light therapy, then there's more lubrication, and that's really helped them with intercourse.
Right.
So all different women with really different issues and fantastic results.
Yeah. And then just to kind of, as I look at that, I'm thinking of a vibrator, and I know you're not
Yes.
intending it to be used as such, but there is a vibration setting on the wand as well, is there not?
There absolutely is. So we have tried to stack or pair different modalities within the wand to have it really optimize tissue health. And vibration is a tool that physios have used for years, when you think about it externally, to increase blood flow, to have tissue relaxation, or even to help your brain connect with a muscle that may have been damaged or might not be working optimally. So what we did was we built 4 different levels of vibration into the wand. So it goes from a really gentle, and I've got to stress, really gentle level of vibration for those that might have a lot of hypertonicity or tissue tension, people that are suffering from painful intercourse, who just have a lot of sensitivity in the area. So low level vibration to help relax the pelvic floor muscles, to the 4th level of vibration, which is by no means strong, but it is definitely present, where your brain will be able to connect and identify the pelvic floor muscles that much more easily. So if you put the vibration level on with the red light therapy and even pair that with strengthening exercises for the pelvic floor, you're going to have, like I'll say, stacked therapy for optimal results.
Great. And then how often should someone be using it? Let's say if they're if they're dealing with recurrent bacterial vaginosis versus endometriosis related pain.
So we generally say 3 to 5 times a week is optimal, not more than once in a 24-hour period. Too much of a good thing. It's not a bad thing, but you're going to have diminishing returns, really,
Yeah.
right? So once every 24 hours or 3 to 5 times a week is ideal or optimal. If somebody is, when in my practice, if somebody is starting out and they have a fairly severe condition, right? And maybe it's incontinence or they have infection or what have you. I always say, hey, let's start off and gain some momentum. Use it more like the 5 times a week versus, say, the 3. There's a 10-minute timer on it, so that helps take out any of the guesswork. So I'd say use it 5 times a week for 10 minutes and stack it with the other therapy that your practitioner may have already prescribed for you. And then as your symptoms get under control, so maybe your incontinence is reduced, you're able to identify the pelvic floor muscles, or your infection has cleared, then you can use it more as a maintenance home device. Definitely suggest the 3 to 5 times a week just to get some momentum with whatever the condition is that you're dealing with.
Yeah. And should people use lube with it? And then
Yeah.
how do they clean it?
Great questions. So yes, you need to use a water-based lubricant with it. And that's because all of the shaft of it here is medical grade silicone, right? So you don't want to use an oil-based lubricant because it could react or break down the silicone over time. So water-based lubricant. And then for washing it, it's just soap and water. So it is waterproof. So you don't need to worry about having the handle part get wet or anything like that, but soap and warm water.
So before I knew about the wand, I talked to a lot of patients about getting a belt and using that. But I'm also curious with the wand, and I'll be looking at this and maybe do like a small clinical trial, so to speak, in my practice, because I think that in some patients, the belt can actually maybe improve the lining of the uterus and help with egg quality. So, with the wand being closer to the uterus, I'm very curious to see if it'll improve the linings of patients who have a thin uterine lining who are trying to get to transfer. So, I mean, to say excited is an understatement, but I know it's silly to say you're excited about a wand. I am very excited about this wand. But for patients who are not comfortable with a wand, because some patients don't want to do something like that, and no matter what, they just won't. You know, they don't use tampons, they just use pads, and intercourse is very uncomfortable for them. So the thought of the wand is not something that they'll use. What other options do they have?
The product that we recommend for women that aren't comfortable using a wand or are just not I'll say not there yet or just won't be there, period, is we have wraps, just as I'm holding it upside down, as you had mentioned, and it has LED chips in it. And we recommend the wrap for women, as we mentioned, that aren't comfortable with a wand, or women that, for example, would really like or benefit from having a wrap over their abdominal area or their lower back. And exactly what you said, it can really help with increasing blood flow to all of the pelvic organs and tissues, which, as you mentioned, may help increase fertility and reduce inflammation or pain, help with scar mobility. Honestly, there's a really long list. I find the women that have commented the most with the wrap or the wrap wand combo is women with endometriosis. We've got a number of really beautiful testimonials from women that have said that it has really been a game changer for them.
Yeah, that's so satisfying, I'm sure, for you guys as a company, knowing that what you're doing is so impactful. I can only imagine. So I bet if I took like 5 people and I had them in a room and I said, what is a pelvic floor specialist? What is a pelvic health expert? They probably wouldn't know what that is and what that means. So, and why it's so important. So, can you break down like why it's so important to pay attention to your pelvic health and what that really means to see someone with your expertise?
For sure. And it's interesting you say that. I'll have women come into my practice because they're their GP has recommended they come to pelvic floor physio. And then when I describe what it is, they say, oh, I didn't realize that, right? So that's a really fair question. So pelvic health physiotherapy is I will say a specialty of physiotherapist who is rostered to be able to do internal work. So of course I start externally, and I start with women with their posture and their breathing and really trying to optimize their pelvic position and so on. So giving them education for that. But then we also will do, I'd say 95% of the time, internal work. And I will be able to actually touch the internal muscles and get a sense of whether or not the muscles in the vagina are really restricted and tight and maybe causing someone's pain or irritation, or are they actually fairly lax and it's very hard for the woman to develop tension or to contract the muscles. So a lot of the therapy that I provide would be optimizing the muscle function in the pelvis for whatever the condition might be. But second to that, we also work on scar tissue, scar mobility, and that could be in the lower abdominal area if someone's had abdominal surgery or if they've had a C-section, and increase blood flow to that area via manual therapy, scar tissue work, and so on. And if we step back, if we have better blood flow, better tissue mobility, then the organs, our reproductive organs, I'm going to say they're going to be happy. And I say that sort of loosely, but then they're going to be able to move, they're going to be able to flow and have optimal position, even for someone who is trying to conceive.
Liz, you touched on breathing for a second there. How is that related to the pelvic floor?
Oh, for sure. So when I think about the pelvic floor, the pelvic bowl, all the muscles that are inside the pelvis, I immediately think to start by looking at our diaphragm. And that might seem weird, but our diaphragm is also like a dome shape that sits essentially on top of the pelvic floor with all the organs in between, right? And so if we aren't using our diaphragm, which is our primary muscle for breathing, for respiration, if we're really tight and we're stressed and we're breathing all up through our shoulders, then we don't have a nice up and down trampoline flow to our breathing. And our pelvic floor, which really mirrors our diaphragm, is also not going to have a great flow. So what I do with women when they come in is I really do start by saying, okay, here we are. We've got our diaphragm, which is kind of around the lower rib cage. And I work with women on learning how to optimize their breathing so they're not all up sort of in their shoulders, which so many of us are with our busy lifestyles and stress. So working with women and teaching them how to use their diaphragm for breathing. I'll have them put their hands on their ribs and actually expand and breathe into their rib cage. The analogy I use is like, imagine your lower rib cage are like the wings of a bird that have to come out and then come back in, right? So regulating their breathing pattern. And then I'll have women image their pelvic floor, also having that same opening and then sort of passively retracting and opening and retracting. So we really tap into a woman's parasympathetic system. So that's their down regulation, their calming and relaxing system through their breath to optimize the flow of their pelvic floor and their diaphragm together.
Yeah, that's incredible. I think you're right. I mean, even while you were talking, I was noticing I breathe up in my shoulders, and then I was doing some deep diaphragmatic breathing. So it's also very relaxing too. How can red light therapy complement fertility treatments like IVF or even egg freezing?
For sure. So when I think about a woman that's coming into my practice who is looking to optimize fertility, I think about down-regulating their nervous system. So there's a really neat red light therapy protocol, really interesting. It was developed by Oshiro, a Japanese doctor, back in 2012-ish, where it's called the proximal priority technique, where he uses light therapy actually up into the sort of anterior neck region proximally to increase blood flow into the brain, and that's into the anterior and posterior pituitary, into the hypothalamus, etc., and increase, again, that parasympathetic system relaxation via using blood flow into the brain. So he will put red light therapy onto the neck, you will see actually, and this has been shown with more recent research, a complete warming, increased blood flow into the whole torso area. So it's like a central, let's say, application for more of a distal application. So it's really neat when you're looking at fertility and having calming, relaxation, and increase in circulation blood flow into the brain, which is kind of like our powerhouse. That's our center, right? And then applying light therapy, say by way of a wand or a wrap or what have you, down into the actual pelvic region. So my recommendations using this proximal priority technique as a basis would be to start centrally and then move peripherally, and also to use light therapy in the, let's say, lead up, so at the beginning of your cycle prior to ovulation, to optimize potential conception or egg retrieval or what have you. If someone doesn't, say, actually conceive in that cycle, to take a little bit of a break and then start again on day one using light therapy again.
Mm-hmm. And do you tell your clients not to use it after ovulation, or is it okay to still use it after ovulation?
To be honest, there's no evidence to show that it would be negative. So I personally, if it were me, I'd be using it. Let's just
Yeah.
keep it going.
Yeah.
And the research has shown that it would be best to start light therapy 3 months in advance of, say, an egg retrieval or what have you, because that follows the course of egg development, right? So there's nothing harmful. However, I do note a few of the women that I've seen, they say, you know what, I think I'm just going to take a break for a week,
Yeah.
and then they'll get back to it.
Yeah. Yeah. No, that makes perfect sense.
Yeah.
Thank you for all that information, especially the neck placement. Because I always
Mhm.
wondered, I have patients that place it on their neck and their abdomen. They do it twice a day with
Yes.
their wrap. And I'm like, I just don't understand why the neck would help. So that explanation was perfect. But I think the studies, are they called thermographic studies? What is it called? The
Yes.
heat
Yes.
studies? They're
Yeah.
quite impressive.
It's really neat to see those that have had light therapy in
Mhm.
such a, like, I'll say, central location like the neck, where we know we have a lot of large arterial flow. But it is really neat to see how that flushes down through the whole
The
torso
whole
and
torso.
has, yeah, a
Yeah.
distal effect when it's proximally placed.
Yeah. I want to talk about guys for a second
Sure.
because red light therapy can potentially even improve testosterone levels. I tell guys maybe put on their arm or put it on their neck. Do you have recommendations for men?
Yes, we do have men that have been using essentially the wrap that I showed you around the whole genital area to improve sperm mobility, sperm quality, etc. And the research there is pretty compelling.
Yeah. Does
The
your
research is
wrap,
great.
I agree. And does your wrap transmit heat though? Because that's the one thing I worry about is heat. So I tell guys not to wrap it around their
Yeah.
genitals.
The wrap will have a gentle warming effect, and that's from the near infrared light. But it is certainly not a wicked thermal effect that would be, say, damaging to the sperm, or that's what the research is showing. And you're not going to, I'll say, tightly wrap. It's more
Right.
just placed.
Right. Right. That makes sense. That makes sense for sure.
That's not why the wrap was designed. But this,
Right.
so I'll say this is like an off-label use that we've been hearing feedback,
Yeah.
right? And so I'm not commenting on, say, the research with our wrap in particular, but more the feedback that we've received from men for off-label use.
Right. Right. Right.
Yeah,
So, how can listeners connect with you or learn more about Fringe Heals and the tools that you offer?
for sure. So our website, which is fringeheals.com, has a whole blog section that has been written by our scientific director, Genevieve, and it has lots of different links to the research that we've used when we're designing our products. So all of the products are really backed by research. So you can read a lot more about light therapy, not just for the pelvis, but in general from our website blogs. You can follow us on Instagram. We're at Fringe Heals. And if anyone has actual questions, we have an amazing customer support. And so that email would be hi@fringeheals.com. And I'm Liz. I'll get most of those questions directed to me, and then I respond essentially. So feel free to DM us, to email us, and just to check out the website.
Yeah, that's great. And how long does it take to get a wand?
They ship in 2 to 3 days.
That's great. Liz, is there
So
anything else you want to add today?
sure. I think the only thing that we didn't necessarily touch on is the actual size. I was describing how it's medical grade silicone. It's got the vibration. It has red and near infrared light therapy, the blue light therapy, but the size of it. We have consulted with a number of pelvic health physios when we were designing the wand. And you'll see it has a really gentle curve to it. And then the circumference of it is really quite small. So if we look at like the size of my thumb, I don't know if that's going to show well, but the
Yeah,
size of my
shows
thumb
up.
and the size of the circumference of the wand, it's meant and designed to be very comfortable and manageable. So it's not meant to be intimidating, even for women that have pelvic pain and dysfunction.
Yeah. Yeah. Well, I think what you guys have invented is incredible and a game changer. And I am just so excited to introduce it to my practice. And I'm very curious to see if it'll help with the lining of the uterus too. So that's what I'm most excited about for patients who have a thin lining.
Amazing. Thanks so much
Yeah.
for having me, Dr. Amy.
Of course. Thank you for joining us. Liz, thank you so much for sharing your expertise today. For everyone listening, links to everything we discussed will be in the show notes. Don't forget to subscribe to the Egg Whisperer Show on YouTube and Spotify. Keep shining, stay hopeful, and remember, every step in your fertility journey is a spark toward your dream of parenthood.